The horses are here about the same time pizza got here, which is kind of a strange day for a buyout rescue, but it's how it's working. It's about noon, 12:15, and Tawny and I are driving up to quarantine.
You never know when they're going to show up, and they showed up at lunchtime.
Yep, and that's okay. And there's a lot of animals. Do you remember how many?
We also have pizza getting delivered, but we have to go.
Yeah, there's pizza on its way. They'll bring it up. We'll be able to grab slices here and there. But yeah, the horses are coming up to quarantine right now. I'm sure the vet team are already all set up and ready to go.
No, they're down here.
Oh, they're also down. Oh boy,
We thought we were going to be able to eat lunch, but
we thought they were going to come out right after lunch, but they're here before lunch. So here we go to quarantine. So we're up in quarantine now, and the horses are right behind me. We're supposed to be getting like 30 horses today, so we're going to see how many horses show up and get right on the process of getting them assessed, see who's doing all right. Hopefully most of these horses can make it through to the adoption program. That is our goal, so we'll see. Large trailer's coming in. Gonna be swinging that door open, see who gets off here real soon. Alrighty, there they are. Look at this poor little guy. Oh, so skinny. It's a pretty gray. There's a couple mules, it looks like to me. And yeah, this is the first trailer getting unloaded. This horse is completely blind, it seems like to me. Easy, buddy. Easy. Yeah, poor horse. All right, but look at this poor little guy. And little white ones, so cute. Little mules. So far, everyone's behaving, not kicking each other or anything like that. Hi, buddies. Easy, guys, easy. Alrighty, and this is the second trailer group. There's see a Brandon Mustang in there, and a bunch of horses. That one's limping really bad, the big one right there. But this is the group. This one looks like a little Arab face to me. And yeah, we're doing the almost live assessment now. And Dr. Lydia and Dr. Gina are gonna get right to work on these horses. It's really weird starting the assessment intake out with pizza, but we got pizza. The horses got hay. I'd rather eat pizza than hay, but look how much they're enjoying this. Just yum yums. Right on, guys. We'll get some delicious food. They're drinking, they're eating. Give a minute before we start doing the assessment.
Hi, are you
Dr.
okay?
Lydia's figuring out who is who and
guys-
what's going to be happening.
Can I have a lead rope? This Arabian that was lateral, just a lead rope. This Arabian that was down in the trailer, let's start. I'm really concerned about both carpi. The right carpus is not at a good angle. It's kind of buckled over. There is an open wound on the front of both carpi and a open wound over the withers. So we're gonna take radiographs of those and take a look. If all we have are wounds, then he has a heart murmur. Oh my goodness.
Oh, that doesn't sound good.
It's like a decrescendo.
Yeah, that's a 6. Yeah.
Heart murmur with 6. That's so sad.
Oh boy.
What is up with this?
There's maggots packed up underneath. If you look closely, you can see them all packed up in that wound.
Maybe we won't look too close for y'all, but oh, maggots don't sound good.
Okay.
I don't know if he banged his eye or not, but his
Okay, I'm
spare on
sorry.
his side is very edematous. Or hemorrhagic.
He's only like 13.
Only 13
Based
years
on this
old.
side, I gotta look at the other side.
All these problems, only about 13 years old. Alrighty,
Yeah.
giving this horse some Butte. Gonna get some radiographs, some x-rays on him.
Oh,
See
he
how
likes
his legs are
pizza.
You actually ate the pizza?
Pizza crust.
Huh. I haven't gotten the horse to do that for months.
I know.
It's like,
Okay.
well, I'm getting stuff in my mouth. I might as well get pizza.
Good boy.
Just sweet boy. Did you check this other side? Did you determine 13 was about right?
I rounded him up to 15,
Okay.
but he's not older than 15. These maggots and some SWAT. We get x-rays.
GI sounds in both places?
Upper quadrants.
So the x-ray has dead batteries on the receptor plate again. And
Let's get a little thing on.
so they're going to be getting charged. And he's going to go in a stall for just a few minutes. Let the batteries get charged up. Then we'll be getting some x-rays on him.
But when we have rad equipment up, we will get to him. This one was down.
I think that one was down.
This was down in sternal.
Like you saw him over the thing.
Okay. Hey, bud.
Dr. Lydia getting the next horse.
Yes.
Alrighty, taking a look at this
Hey,
one.
buddy. I'm sorry. Thank you.
Blue Run Quarter Horse Gelding. Curious to see how old he is, but his knees are kind of messed up.
Emily, are you taking notes?
Yes, ma'am.
You have a mass in the lateral canthus of the left eye.
Okay.
Oh boy.
Lateral campus? Yeah.
33, 34.
33 to 34. We'll go with 34.
Sweet boy. Old fracture. Yes, thank you. Hey, buddy. All right, bud. You got some dental pain. His mandible is completely locked. No lateral movement is possible. He probably has some pretty bad teeth.
Yeah.
Johnny's getting photos.
Small bay horse with the star moving on the little
So I know it's hard to believe, but Dr. Lydia aged this horse at 33, 34 years old, so that's pretty crazy.
This horse is a very old horse, but I'm not surprised in the fact that his breeding and the way he's put together, he would have been a very desirable horse. Do you want to be in the photo? Very desirable horse. And they just used him as long as they could, and instead of making the right decision for him, somewhere along the line, they probably gave him away to someone who's going to give him a good home. And unfortunately, he ended up in the slaughter pipeline. But I'm sure, the chances of him ending up here are very small for the amount of horses that go to the slaughter pipeline. So I am so grateful that he found his way to us through your support instead of, he could have just disappeared forever. And he's a very sweet horse. It's been around for a very long time. And he could have just disappeared, but he's here instead. So it's hard to say goodbye, but it's also peace knowing that he didn't go to a slaughterhouse.
So what are you seeing on this horse?
Very severe lameness in multiple limbs, but most significantly the right hind, with a lot of swelling and effusion in the distal right hind limb. This horse was down in the trailer, and he has a lot of superficial injuries that just happened, but I'm most concerned about this right hind leg.
She's the one that does all the pokes, so she definitely wants you to be her friend.
Oh, his heart rate is almost 80. Let's get those pain meds on board. ASAP, can you hold him? Got it. This feels soft tissue, so radiograph would be great, but we could start with an ultrasound if the rad equipment is still out of commission. It was almost 80, so he looks very stoic, but he is painful. And you can grab a little flake of hay and stand him right there. I'm going to sedate him a little bit so we can do some diagnostics.
Can we pull him all the way out?
Yeah, okay. That'd be great. Thank you.
Oh.
He's a very good boy.
Very handsome.
He looks around 20, maybe 21. He has a severe lameness of the right hind leg, like toe-touching lameness. His resting heart rate was 80. He has had 10 mils of banamine. I'm about to give him some dormosidane. I'm not sure if the right hind injury is soft tissue or bony, so we're gonna take radiographs and ultrasound. Oh, you real hungry? You need some foods? Need some grainies? This horse also looks like he or she has a recent shoe job. You can see the rasp marks. Do you want to come in here? You want to come be our next patient? Here we go. Can you close this? This horse appears to be very calm and broke, but thank you for the reminder. I'm the worst about that. This horse is bleeding from the left nostril.
Yeah, 17% on this battery.
Dang, okay. Let's throw some lead on.
That was really, really nice and easy. Alrighty, they're getting ready to throw the X-ray machine into function and get some X-rays taken.
Very gross. We might have to just take non-weight bearing initially. My hand is really gross. Ooh. What a good boy. Easy. Might add a little bit of movement, yeah.
There's
Here.
lucency over that
Yeah.
sesamoid.
Let's take the DP. You want to be in front?
Sure.
Good boy.
Trying to get parallel with what he is.
Ah!
Yeah.
So this bony column is supposed to be aligned. And you can see that this bone isn't lined up with this bone, and these bones aren't lined up with this one. So we have lateral deviation of this digit across 3 different joints.
So is that a mechanical injury? Is it just over time, or?
It is a primary musculoskeletal injury that's probably been present for a really long time. This could be a fracture right there. I mean, that's a lot of opacity change over that bone. But likely like full soft tissue, and you can't even see how bulbous this is, but this whole area is really, really warm and tender. This horse has been very sweet and let me palpate this leg even before he was sedated. But with a resting heart rate of 80 and toe touching lame is when they don't want to bear full weight. But unfortunately, this horse has painful front feet and painful other legs, so he really isn't able to fully take his weight off of his most painful leg because he's got pain elsewhere.
How old is this horse?
Well, what do you think? We'll need to put the speculum on and get a look at the back of the mouth. But first,
He's
we're
an adult,
going to
for
use
sure.
our battery while we have it.
All right, finding out what's happening with the withers.
Eek!
That sounds terrible.
You want to see? The fragments.
Yeah, it's communicating down.
Extensively present. So this indicates very deep infection. Let's go take.
Fistulous withers?
Let's take carpal rods next. We're gonna save that. Yeah. Yeah.
Also, Jason is behind people wearing lead. You were not.
You can see the gas tracts from the outside going all the way into the bone, and you can see the roughening of the edge of the bone right here. So unfortunately, this wound extends to the depth of the bone.
Like a puncture wound to the depth of the bone?
Yes.
Poor buddy.
I know. Yeah, we got all of the,
Sorry.
look at all this roughening up here too.
Yeah. Yeah.
So this is the way it goes. Our veterinarians, they check the most critical looking horses first. And so far, they're in really rough shape, but they're doing what we can for them. And some of them we are having to say give them the last act of kindness, say goodbye to them, but they're not going to slaughter. And that's what it's all about.
I got 30. Oh, okay. It's very, very comparable.
Alrighty. This horse basically doesn't have teeth. Now we're getting some dental radiographs.
We were lined up. Say, I'm a grown adult and I'm old enough to be out of my mommy's house. That's all that matters. Hi.
Yikes.
How nasty.
So we have a lot of movement.
Ooh.
But we definitely are missing multiple teeth. And so this is periodontal ligament. Our occlusal surface is supposed to be parallel to that, and we can see that it is not in this case. I would love to look and see soft tissue wise what that mouth is doing, but Dr. Gina, what do you
Trying on the radiographs again.
We're worried about this. Oh yeah. That's not. Thank you. This is a very abnormal opacity change. And you can see we've got a missing tooth here and then missing tooth here. Yeah, that's soft tissue. Is in his 30s. He's missing multiple incisors, premolars, and multiple molars. He has a severe hook and wave mouth on both sides. He also has a moth-eaten appearance to the left distal mandible that's possibly consistent with neoplastic processes. His body condition score is about a 2, and I'm going to look in his mouth and see if I can learn more. Sorry. You're okay. You can loosen up on that lead rope a little bit. Oh man, but I'm sorry. I know your jaw probably hurts. I'm really worried that this horse is not going to have the ability to gain weight with no teeth. I also think he might be a little neurological, although he could just be weak. Well, that is failed proprioceptive placing on the left hind. Normal on the left, abnormal. Sorry, normal on the right, abnormal on the left. Okay, bud, I'm sorry.
Next up is a cute little pony.
So Dr. Gina and I already looked at this little guy moving around. This is a gelding. He's got really severe overgrowth in all of his hooves, but he appears to have a condition called upward fixation of the patella. I think the layman's term is string halt in both hind limbs. That's just from watching him move around out there. He also looks to be possibly vision impaired, so we'll get a halter on this little guy and take him from there. That wound looks really superficial. I think that was probably just from trailering.
It looks like Clippy, you know, the old Microsoft thing?
So this little pony has double string halt in his back legs, and poor guy, and he's vision impaired. And
Okay, can you ask him to stop? Good boy.
Toe dragging, which he doesn't have the characteristic slap of
You're exactly right. Easy.
and
See how he's just like moving back and forth?
and we've got rain. And on this particular camera,
You're a good boy.
it's not water
I
resistant.
know. Maybe a 4.
Except the way he was definitely showing some strange behavior in the pen.
Easy. So there's 2 ways that your proprioception can be abnormal. It can be delayed or it can be exaggerated. And when he like jerks his leg up like that, I would call that an exaggerated and abnormal response. Yes. But you're right, he's got a toe drag as well. See how he's like coming up on his hind toes? I know. Ooh, something just, yeah. Okay, okay. Yes, abnormal proprioception. He's got a lot of heat in his back right here. Abnormal proprioception means you can feel your feet, but your brain doesn't know where they are. You're a good boy. You're a good boy.
So one thing, well, let me spin around here. One thing I want to point out is Dr. Lydia is wearing a microphone. Dr. Gina is not. So if Dr. Gina, you know, you can see her lips moving in the background, but you can't hear her. That's because she's working just as hard. She's getting as much done. But she doesn't have a microphone today, so.
Well, what's great for me is I can take Dr. Gina's brilliance and then just repeat what she says, and you guys won't know that I'm stealing her brain. Thank you, that's super helpful. Do we have pictures of this one?
I don't believe so.
She is not readily handleable, so let's get pictures of her before we get her in. Good girl.
Look at that.
Thanks, Jordan.
Very nice.
So far.
Well, maybe she'll be our first.
Yeah.
Probably not going to be really
Yes.
easy
Yes.
for haltering. Probably not.
Hi, sweet girl.
All right, she's going into the squeeze, padded squeeze chute so that she can be comfortable. Come on. So she's getting everything. This is the first one to come through. That's good to go. And
At least 2.5 and not 3.5, so she could be 3.
Then it's okay.
so she's young. So
She's young, yeah.
young and untrained and
Yeah, I could go with 3.
ungentled
Yes.
and ready to go as soon as quarantine
Did
is
we
done.
see a weight on her, you guys, before she went in? Good girl. I'm going to turn this on, okay?
Getting microchip. Again, this is a unhandled, untrained horse.
And we can give rabies on the left
Haley here
is fine.
could gentle this horse down in 15 minutes, probably, maybe 30. 10 minutes. But Haley enjoys the rain. She's from Florida. It doesn't rain very often, and She finds the rain soothing, I think. And pretty much the rest of us are either out taking care of the horses in the rain, or we're under the nice big roof, because we're not a big fan of the rain, but the rain's here.
Let's close this door just to keep it safer for you.
Alrighty, here she comes. Careful, careful. Out you go.
We're not standing out in the rain, but it's Tennessee, there's wind and rain, so we've got some moisture coming down. We have most of our equipment in a safe spot, but you can see the rain has kind of made some water pool here, and then like our ultrasound and x-ray equipment are safely put away, but our lead aprons are getting wet, which isn't the end of the world, but they get moldy really easily because they're so heavy. So we're really looking forward to being able to work in climate control. And then we don't have lights in this barn either. We have some lights, so when it gets overcast, it's actually lovely right now. It looks like a Victorian painting out there, but it gets a little bit harder for us to see.
All right, Tawny's getting the next horse out of the pen. She already got pictures on it, so hopefully it'll be just ready to go. Get the assessment done, get the intake done, see how she's doing.
Oh boy. Sweet girl. Yeah.
She has her teeth
Easy.
behind midline.
Yeah.
Like she doesn't stand square in the back. She keeps.
Yeah. I think it's, yeah, she's very reactive.
Oh.
Easy.
You hearing anything inside?
She's got reduced GI sounds in both upper quadrants.
Getting some Banamine. Make her feel better.
Very like.
There's a mysterious brand on her.
There's some over here, I thought.
Emily's got the razors.
Oh. This is 413, correct? Yes.
That doesn't seem to help much.
I have it all.
That looks like an H, but there's two lines.
Her teeth are not worn well, so I'm hoping that brand can give us a more accurate age than looking at her teeth can.
I have enough blood for blood.
Let's do it. At least a
Maybe
CBC.
an A.
I've seen better Egyptian hieroglyphics, man.
Yeah.
This poor little pony.
Got some.
He's going to be the
Here,
next
Tawny.
one up.
This gate is not all the
The
way.
whole side of its
Yeah.
face is.
Oh, you smell infected. I'm sorry, little buddy. Yeah, you smell very infected. You got all the pictures? Oh my goodness, the smell.
It's got.
There's
hole.
pus. Yeah,
And this is all.
yeah.
It's like major tooth problem or something.
I would love facial rads on this little guy, and also Cushing's testing. Do you see this tract? So this abscess has ruptured out here, here, and here. And then there's just a ruptured abscess tract across the muzzle. It probably hurts you so badly to eat.
Meanwhile, Haley's hanging out here with the long ears, getting bullied by the schoolyard bullies because she's got a bag of treats.
So with these really old, really small guys, it's often more superficial. There you go. And I want to do a CBC chem and Cushing's. Yeah, great job. Yep. Let's give this little thing 3 mils of IV Banamine.
Then this horse is getting sedated for radiographs of the spine, and be good to see what's actually going on inside. It's very painful on palpitation of the spine, and she actually offered to kick, so we're being very careful with her, and she's getting sedation she needs, so everybody's kept safe.
Easy. Everybody just be careful with this horse. She's an increased fall risk. And she didn't threaten to kick me, but when I palpated her lumbar spine, she picked her leg up and demonstrated that she didn't want me to do it, so. patient movement. It's going to be non-diagnostic. Okay, let's try that again. Okay, we need to go a little bit further distal. Good girl. I know.
You're doing so good.
Emily, if you can square her up a little bit, it would help a lot. There we go, yeah. Please do not kick us.
Ma'am, stop moving.
So I suspect that I want to take one, let's take one more and then I'll talk about it. She's got majorly touching vertebrae back here.
Do I need to move her?
Nope. Dr. Gina, can you go a tiny bit more distal and just be careful. She's like really tail swishing. That was not diagnostic. Well, actually, Dr. Gina, you want to come look at this? So we have multiple areas of concern. This is lumbar spine, and we've got vertebrae overlapping with each other. This isn't the most diagnostic image, but like these vertebral bodies have to be compressing nerves and everything that runs through the spinal cord right here. And then it looks, nope, not that one. That one's not very useful. This one, this should be SI, and it looks like there's, like if there's enough overlap here. Again, this is not the best image, but I'm worried about the opacity change in that vertebrae if we've got overlapping and touching right there. It's consistent with where I'm palpating those clinical signs.
Yeah.
Yeah.
I don't think we'd be able to keep her
No.
managed very well.
So this, Mara is a branded standardbred. She's only 14 years old. She has abnormal left and right hind legs, but the issue isn't actually in the legs themselves. It's in her spine. I'm going to put this down somewhere safe, and then I'll show on her body. If we want to, let's hop right in and radiograph his face. So when you look at this, Mary, you can see the shape of her back right here, right about here. And you see how she's kind of wringing her tail. Even when I tried to palpate right here, she picked her leg up and threatened to kick me. So she's got vertebrae that are touching and overlapping each other. My dad just had surgery for spinal stenosis. It's incredibly painful. So she's got pain and narrowing here and in her sacroiliac joint. So she's got pain and probably nerve pain associated with her back right here. There is surgery to correct kissing spine in horses. It's called a hemilaminectomy. There are a couple different procedures they can do. Dr. Gina and I are not equipped to do those procedures. And anytime we're operating on the spine, it's basically neurosurgery because we're dealing with the central nervous system. So this mare has had pain meds. You can see how she's kind of wringing and spinning her tail, and her face is holding a lot of discomfort. Her heart rate was pretty significantly elevated. So she's got discomfort of that spine that's affecting both of those hind legs, and she's just really uncomfortable. So unfortunately, I don't think there's anything that we can do for her here at Horse Plus to ensure that she stays comfortable, and we're recommending the last act of kindness. Okay, let's go a little bit further out here, and we're gonna shoot left to right.
Lucky day.
My kids have seen that movie 8,000 times. Emily, can you smell this horse's face?
A little bit.
Yeah. So I'm going to recommend that you hold, yes, perfect. I'm going to make sure you're, yeah, you can see the training check. Good boy. Further down a little bit. Yeah. Whoop. And we're going to need to take one a little bit further proximal as well.
Hi, you're very cute.
Oh, yay, receptor is 38%. Holy moly, look at those teeth. All right, we got to swap that halter out.
They look like they're trying to poke up through the.
Alrighty, we're gonna try this one again. The last one showed a whole lot of metal buckles, but the rope.
He's like, oh, treats, thank you.
Oh, yeah. So this is the,
It touched.
this is abscess tract, and look at, so our occlusal surface, again, should be a nice parallel line with periodontal ligament. We have missing teeth, and we have a really bad hook wave mouth. Let's take a little bit further distal, like that whole muzzle has a tract, and then we'll try to do DP. It says warm up. Now it says ready. Sorry. I'm sorry, we're gonna have to wait until we're not chewing.
Who gave the
Whose
treat?
idea were the treats? Me. It's me. Okay.
No chew.
That's right. Say that again.
No chew.
You drop down a little bit more, Dr. Gina. Yeah. Good job. Good job.
Still not looking good.
The gas tract with this abscess is here, and then we've got gas tract here. So gas is black. This is normal. This is just air underneath his lip. But all of this right here in the skin and all of this here is all associated with that abscess. Can we try to take a DP?
Sure.
Emily, this is going to be a tough one for you to hold. Yeah. Whoop. Whoop. Come on,
Things
sir.
we can do on little patients, we can't do on big patients.
Listen, try doing this to an elephant.
Too much motion.
There's a lot of motion. It's not bilaterally symmetrical, regardless. Definitely have a lot of dental pathology. I would love to try that again, and I would love to get the whole muzzle. So I think our pathology is primarily like here down. Yeah. He's like, where's the treats? Good boy. That should have been it.
His buckle's in the way, but.
No, actually it's not. See how it's over to the side?
It's a very nice looking
So you can
buckle,
see
though.
like this tooth is fractured and missing most of it. So you can see we should have a tooth right there. Got an affected tooth root right here. This is the side where all of that abscess is. And you can see how the opacity of these teeth is different from the opacity of these teeth on this side. And then we've got a lot of soft tissue swelling and gas tracts over here, and a lot more down over here. So in a lot of these cases, if we wanted to further map those abscess tracts using our ultrasound would be what we would do. In this case, I'd have to push on it. Same thing with the last horse with the major changes in his hind leg. To get a really accurate ultrasound image, I'd want to really heavily sedate him more. This x-ray is a little bit less invasive, and because we have an answer on this x-ray, we're not going to go with the ultrasound.
And more x-rays.
Suffocating.
Oh yeah, that's
joint.
real significant. So this is pretty normal looking, smooth. All of these little,
The joint's fused, isn't it?
it looks like it's partially collapsed. Let's take a DP. It's trying.
Is it arthritis on
trying to
layman's term
arthritis.
or something else?
This is called ring bone, and it is
Oh.
severe osteoarthritis.
Gotcha. Well, he was probably worked a lot.
Oh yeah.
He was a halflinger and they are.
Woo! So to see these big hunks of bone, and especially that they're not attached; they're just kind of like out and floating.
Oof, bad.
Yeah.
So,
Not good.
Floating chunks of bone. That's just so
Okay.
bad. Poor guy.
Yeah, but you like black. This one's like a dark.
Beautiful Arab. He's coming on into the scale. He's like, no, I don't want to. He really doesn't want to get into the chute. Sad. Well, he actually said no enough that we're not going to worry about a wait. And gonna come around. And hopefully he's okay for needles and things like that.
Because if he needs,
Dr.
Hi,
Lady's gonna get
Bubs.
a heart rate. lung
I thought this horse
sounds,
was actively dying in the
and
trailer.
everything else.
And when he got off the trailer, he chugged a bunch of water, so he's probably dehydrated. Heart rate is normal. So let's do microchip first. If his temp is normal, we'll give him all the vaccines, and we're gonna put him in quarantine. We're gonna put him in Strangles quarantine because he's got mucopurulent nasal discharge.
You want to take a radiograph? Sorry. You're fine. Could have made it easy.
And look at that Arabian face. Oh, perfect. Perfect for pokes.
He's a good boy.
Nice.
I suspect orals are gonna be our problem.
Yeah, he's the back.
They opened the back panel, yeah.
All right, so he had everything done to him, and he's going off to quarantine.
19.
19-year-old Arabian.
This horse was laterally recumbent and on the verge of death, looked like in the trailer.
I think he has a hip hike though.
Looks a little bit. He was chugged a ton of water when he first got here. We're gonna run full blood work on him. We do need to take some x-rays, but we're gonna run blood work first because we didn't want to sedate him because he looked so terrible when he got here. But he's gorgeous, and hopefully we'll pull him through. He's got pretty decent teeth.
Oh, he's got pretty decent teeth. Cool.
Yeah, you're a good girl.
Yeah, it's almost just like the other horse we had.
What are we thinking of age, Dr. Liddy?
Easy. She did?
Yeah, wasp just flew. She jumped and a wasp flew off of her.
I'm
Poor
sorry,
horse.
big
He
girl.
just got stung.
That was crazy.
That's kind of silly.
Sedated dental, how about it?
Between 4 and 5 out of 6.
Her age.
Her incisors look like 22, 23, but all of these teeth back here look to be in great shape. She needs a dental, but she's got a lot of tooth left. So maybe her incisors may be more worn. Like I would say based on the back of her mouth, she looks more like a 18, 19-year-old.
Yeah. So 19. So 19? Okay. She's 19 years old.
She has lots of solid, useful teeth on both arcades.
4 to 5 out of 6. Mean.
What a sweet horse. So we're going to do everything. She does have a heart murmur, but the vets are going to be checking more with ultrasound and stuff later. But she's making it through, and she's so beautiful. All right, Dr. Liddy says this is a branded standard bred.
No, I've put him at a 4.
This poor horse really looks like he's had a broken hip. You can see there on the left side, it's nice and flat. On the right side, it drops off. That's really sad. But we'll see what the vets say. But yeah, that's definitely some abnormalities going on there.
So Haley, the most valuable information to us is straight line. I know there's no straight flat, but if you can, even just at a walk, just try to walk him in a relatively straight line in any direction. Good boy. Let's listen to those lungs. Did you?
He's got a weird hip. More than likely, like, yeah.
Traveling stealth easily.
Very possible.
Is the horse you guys working on 18, 418?
Yeah, he's 418.
Good boy.
Him on US Drive.
You're a very good boy. I feel like
Ew. Problems.
I feel like
Big
this
bump.
horse might end up being
Poor
a
horse.
lameness call.
I know you're going to be shocked, but it's raining again. And this camera is absolutely, by far, not waterproof. So I have to keep it dry. And here pretty soon I'm going to have to go edit because Haley Macy, as I pointed out earlier, if you missed it, their grandma had a cardiac arrest that she coded in the hospital today. And so they left to go down to be with family. And then John quit recently. So it's me and Justin. So I'm doing all media duties. So that's okay. thoughts and prayers with Haley and Macy. They're needed by their families, so that's where they're at. So that's okay. But we're gonna keep going here for a little bit, and then gonna go get this edited for you guys, and also what they videoed this morning. And it's gonna be an interesting week, but every day, get a new video. Caitlin found a little snowball to play with. No eye. Oh, both eyes, big problems. But he's so cute.
Little stallion is only about 3 years old. He's between 2.5 and 3.5. He's a branded standard bred. He's very off in his hind end, and unfortunately, even without taking a radiograph, you can see how abnormal the pelvis is between left and right. Sorry about the rain.
Quarantine expansion done, and it will all be covered. It will be amazing.
I vote we do blood work first and take dental radiographs, and if everything there looks perfect, then we talk about an enucleation, but not before then. You feel good about that?
Yeah.
Okay. So just to make sure we're clear.
Everybody on this side, I think, should be seen.
Okay.
These ones,
stable enough that we can do tomorrow. Okay.
Yeah.
Great.
Other than this one over, but like.
All right, everybody, I've got to go edit this. I filmed as long as I can. It's still pouring rain. Can't do interviews with Dr. Lydia or anyone. You can hear the rain in the background, I'm sure, and the horses are being taken care of. Intake is going along just fine. I believe they've gotten to most of the absolute critical ones, and now they're just going to be kind of doing the process with the mules, the donkeys, things like that. I wish I could hang out here longer, but especially with Haley and Macy gone, I've got to get down, I've got to get this edited. I know Tawny's going to be grabbing some footage if anything super interesting happens. Hey, just like that, the rain shut off. And yeah, thank you guys so much for watching this almost live intake. Sorry it was maybe not as long as usual, but it's been a crazy week. Crazy month, absolutely crazy month. And we're just going into winter, so hopefully we can get that quarantine barn done up really quick so that we can do these assessments inside a heated and cooled climate controlled building. How great would that be? Can't wait.
At least it's not cold, but it's very wet. When we were out on the Navajo Nation, I think Haley put it the best. In Tennessee, the raindrops, what are the raindrops like in Tennessee?
They're a lot bigger, and they soak you.
And on the Navajo Nation, what are they?
They don't do nothing.
They're soft rain.
They're soft rain. This is not normal.
So we are so excited that we raised the funds for the quarantine expansion. That barn over there is where we'll be, and there'll be a side shed where the horses will be in different pens, and we'll be able to operate enclosed, and we won't be soaked. I'm just thankful it's not freezing cold right now. It's cool, but it's not cold.